Hi everyone, welcome back. I am here to just give you an update. This Monday I'll be 8 weeks post chemo, and I had my 9th radiation treatment on Friday. So I have a total of 33 treatments. I'm supposed to end on February 15th if there are no delays. So getting there, it's slow. It's definitely a lot to go every day, but the appointment is very quick, which is nice. And I think more than physically tired, I'm physically tired, but I think I'm just like so over all of this and having to do anything that has to do with cancer. I'm done cancering. I don't want to cancer anymore. Is that like a new way to say it, cancering? But, gotta do what you gotta do. And I am seeing a little bit of, like a tan on my breast. It's so crazy because you could just see exactly, it's so like on point. It's a straight line coming up here, and you could see it very faintly. But it's wild, the technology of radiation and how exact it is, and it's only in a certain spot, so it's like almost like going to be like a box. So I'm seeing a little bit of a tan coming on, nothing too crazy, not bad. It's not bothering me like as far as like a sunburn feeling. It is a little sore under the armpit area. I'm not getting my lymph nodes radiated, but the way it hits like under here. So that's interesting. Not to be TMI, but my nipple is changing color. It's getting darker, which is expected if the rest of the breast is going to be getting darker in color. Hopefully it just goes back to normal after. So that's radiation. It's not so bad. It's going every day. It's a lot, but it's a quick appointment, and hopefully February 15th comes really quick. As far as being physically tired, yes, I'm tired. I'm not always sleeping so great, but I think I'm just like emotionally exhausted. I'm still very happy and positive, but I'm just tired, and anyone that's going through this understands what I mean. And there is no choice. You have to keep going. There's no pause button. There is no stop. You just continue. I'm still doing holistic treatments once a week, and I'm still on all of the supplements that I take every day, morning and night. And I feel like those have helped me through chemo, and they're going to help me through radiation. And, I feel like they're my body's protection in a way, but at the same time, they're also helping to fight, cancer and to keep it from coming back. So I'll be doing this basically, for the rest of my life. It won't be once a week for the holistic treatment. It will end up going to maybe like once a month for like maintenance. But, as of right now, it is once a week. And I know I keep saying this. I'm going to do a video showing you my supplements, my holistic supplements. Hello, check out this hair growth. That's pretty cool. I just looked at my last video before I started this one, and I think that was on the 5th, and today is what, the 12th, the 13th, so in 8 days, I've gotten some pretty good hair growth. I did lose all of my lashes, except maybe like 1 or 2 lashes on the top, but the others are gone, but they're growing in really fast. I don't know if you could see that. Very close up. They're going in fast. Honestly, it didn't even faze me that my eyelashes were going. My eyebrows thinned a lot, but they're growing back pretty quick too, so that's great. I'm happy. But again, it didn't faze me. At the end of the day, it's hair. I did notice that my hair on my face is growing back, and it's a little bit thicker than what I would like or what I had before. I mean, everyone has like peach fuzz on their face, but I've read that it comes back this way, but then it goes away. So if it doesn't, I'm going to have to take matters into my own hands, but I'm going to be patient. I don't know if I mentioned before, but pretty much all my nails have lifted from, because they were dead underneath. I don't know if you can see. It's a little hard to see, but I've been cutting them down almost every few days just to keep them as short as possible so they don't get stuck on something and break up and get lifted and ripped off. And so far that's working, so I'm just going to continue to do that. Right now I'm actually looking into why I got cancer. So right now I feel like all the doctors are not really looking into why this has happened. They're just kind of like trying to fix what's going on right now. And maybe my holistic doctor is like preventing it from happening in the future with all these supplements and diet, but I want to know why I got cancer. Not like why me, poor me, because I'm not like that, but like what in my body. You don't just get cancer for no reason. There's a reason for it. So I'm exploring, and I just started reading this book. I took the cover off of it, but it is called The Metabolical Approach to Cancer, and it's written by Dr. Nasha Winters and Jess Higgins Kelly. And I mean, they really believe in like the ketogenic diet and stuff, but I'm going to have a consult with Dr. Winters because she really dives into all of your blood work and, looks at your history. And it seems from the group that I'm in on Facebook that all these women who have had consults with her have found out some really incredible information and been able to change their lifestyle and things that they eat and things that they are taking and things to stay away from to help them. And my biggest thing is now I do not want a reoccurrence, and I'm going to do whatever it takes to not get a reoccurrence, to not have a reoccurrence. I turned 32 on January 9th, so I'm looking forward to this year. I do have Herceptin until September, but, you know, it is what it is. That's every 3 weeks. I'm just looking forward to having, you know, a comeback year. I feel like the last 6 months have been a setback, but the comeback's going to be even better. And even though I'm still in treatment and, you know, I'm not able to do nearly as much as I was able to do prior. I worked out this morning and I could barely even do push-ups on my knees, so certainly a way to go, but I'll get there. And it's just about being patient with your body and knowing when to rest. I started working out last weekend, and I didn't work out for 4 days in a row this week because I was just so exhausted. And I have a little bit of a cold, but I felt like this morning I wanted to knock one out, and I did. And it made me feel better, but I'm tired. So just, I'm picking and choosing what I do in a day, and I'm still working full time, so during the week it's still hard, to get everything done that you want to get done. But patience, that's it. I think that's probably the key, is patience. And I probably said patience 5 or 6 times on this video, but it's because it's so important, and I think that we have to be kind to ourselves. And emotionally, when you're patient with yourself, it takes the pressure off, and you're able to handle things a little bit better. So I just want to give you guys a quick update. I don't want to make this video too long. 8 weeks on Monday, post-chemo, 9 treatments in on radiation. Looking forward to the finish line with Rads, February 15th, and Herceptin in September. I'll keep you guys updated. Hopefully the next time I shoot a video, I'll have a lot more hair. Take care. Be well. Bye.